Okay, welcome everyone. I am Dr. Guru Prasad Peruri. I am a neonatologist and pediatrician by profession. I am the faculty for the NEET super specialty Pediatrics, ADRPLEXUS. So the motto of these videos is to sensitize the upcoming students that are the MD pediatric residents about what are the super specialty branches that are available, what are the books they should read, what should be their preparation strategy, etc. We want to get all the study tips, etc., from the toppers who have scored good marks in the recent NEET super specialty. Now, I take the pleasure of introducing to you Dr. Deepika, who is our ADRPLEXUS NEET-SS Rapido student, who scored very excellent score of 279 marks and stood 64th rank in NEET super specialty exam. So, welcome, Dr. Deepika.
Thank you. Thank you so much, sir. It's
Okay,
my
how do you feel now?
Okay. I'm happy and satisfied with my marks and my rank.
Okay, tell brief things about you, like where did you do your MBBS? Where are you from? Where did you do your MD?
Yes, sir. I have done my MBBS and MD from Maulana Azad Medical College, and currently I'm working as SR in MAMC only.
Okay.
August 2021.
Okay. Was this your first NEET-SS exam or did you write it previously?
Yes, sir. This was my first attempt in NEET-SS.
Very excellent score in your first attempt itself. It was very excellent. Okay.
Thank you, sir.
Like, when did you start preparing for your exam about this NEET super specialty exam?
As I finished my MD in August 2021, then I just joined as SR. Then I have decided for my DM exam in my PG days also, but I was not very sure and I was not preparing. So by full efforts, I started preparing in December only. But yes, I was reading for the competitive exam since September or October.
Okay, great. What books did you read?
Sir, for the basic of pediatrics, we need to get through the whole Nelson at least once. That is the main basic part of pediatric. And I read Cloharty and Ames NICU protocol. That was basic for neonatology.
Okay.
And basically,
yeah, please.
Nelson is very important for any student of who is doing MD, because line to line questions are asked from Nelson, and it was very helpful for me because I have studied I have done my MD recently, and I studied the Nelson for the MD exams also, and that was very helpful because I have read freshly, and so I was able to prepare early.
Okay, very good. Just a question of enthusiasm. Like, how many hours do you read per day?
Sir, after doing my duty like 9 to 4 every day, we are busy. So after 4 o'clock, I usually spend at least 3 to 4 hours per day where I will sit and study for some time. But in December, yes, I studied at least for 6 to 8 hours daily.
Excellent, excellent. How did our ADRPLEXUS help you?
Yes, sir, it helped me a lot because your mock test was just a revision of Nelson, and specifically I gave the test, and whatever the topic which were asked in the mock test, I used to read again from the Nelson or Cloharty or our Ames NICU protocol. And it was very helpful because I get to all the important topics recently, so I could recall in the exam. And that's why, and also mock tests give you a real scenario of the exam, so that's why it's very helpful.
Yeah, actually our motto of making the mock test, we design in such a way that a question is not repeated and a topic
yes, sir. And maximum number of topics were revised.
So that is what we targeted. We targeted on more on video explanations rather than on papers. That was our motto. because it should
Yes,
be like a last minute crash course like thing. I think that has worked very well this time. And during your preparation, did you expect that you would get this rank, or did you feel anytime depressed? Should I prepare or not? Something like that.
no, this was the exam where I didn't feel any kind of depression and frustration because I was just doing my best, whatever I could, but I was not taking any kind of stress. That's why I think I have achieved such kind of marks and rank. And there was no kind of frustration or depression, but I just studied.
Okay. What is the super specialty you're going to opt?
I have two choices, frankly. And my first choice was pediatric nephrology. And my second choice is DM neonatology, which I will opt in the counseling. And DM neonatology is I think that is the upcoming branch in the pediatrics. Also, there is a very need of, matlab, like neonatologists are needed in every city, in every part, because we have seen newborns are being referred from every center to a tertiary care center, and they are being referred for very small things, like they are getting hypothermia, mild respiratory distress,
Yeah.
mild hypoglycemia. And so we can change their management, and we can save their life. So it's very important, like even at the small setups where where SNCU are like SNCU are there na, uh, there also we need neonatologists. So it's a good branch for the upcoming future.
Yeah, yeah. Okay. Let us take apart like a brilliant students like you. We will remove. Now, a moderately studying student from a normal state medical college who doesn't have so much facilities like faculty or approach-wise teaching and all protocolized teaching. So, what advice would you give to the upcoming MD pediatric students who are especially from the remote places?
So for the remote places, I will say this online platform is like such a nice thing which have come during these COVID days and all. So it's very like it's easy for everyone. Everyone can have a look in the online platform. There are so many coaching classes, or we can solve our doubt through online, through YouTube channels. Or and yes, Nelson is the base. Every person who is doing MD pediatrics, they have to study Nelson. Also, who want to pursue for DM neonatology, they can study Cloharty and DM neonatology. And yes, of course, they can join like ADRPLEXUS MOOCs and
Not like
near
that.
upcoming courses, like if they want to. And at least they have to study these basic books, and they can crack through any exam, and they can solve their doubts through these YouTube channels, or like there are very some groups like on Telegram and on WhatsApp where they
Okay.
can. Yes, sir.
Okay. And one more question. Do you think, suppose who has completed their pediatrics, MD pediatrics long back, and still they want to get through the exam because you are fresh, so you have an advantage of reading the Nelson recently. But what about those who have done their MD long back and are still practicing or are having private practice and all? Any advice for them? I know you are not in that scenario, but just
Yes,
an
sir.
advice, a hypothetical advice.
So my advice would be like they should join some test series and all, so that they can know what are the important topic for the exam, because they can't read Nelson whole, and
Yeah.
they can't sit back and read whole Nelson whole Cloharty at a time. So it would be important for them that they join some coaching, or some test series, so that they can know about the important topic, and then they can read those topics and go for further.
Okay. So consolidating what you have said is, so students should start preparing while they are doing MD itself.
Yes,
Nelson,
sir. That's a very important thing.
yes, Nelson and Cloharty are the basic textbooks. So first you should master Nelson and Cloharty and AIMS protocols. Then only go for other books. Third, consistently you should keep on reading. whatever it is. By seeing a case, read from the book. Instead of reading the whole lesson and mugging up, concentrate on the important topics and do practice MCQs wherever it is available to get through the exam. And when you are going to the exam, go with a clear mind. That's it. Basically, the synopsis of what you have spoke till now. Okay. It was very nice talking to you, Dr. Deepika. We wish you a very bright future ahead. We wish you will get a seat of your desired branch at a desired place, and all the best for your future.
Thank you, sir.